guess prior to diagnosis, there's a lot of subtle symptoms. You kind of notice the lack of sensations. Sometimes there's extra sensations. I remember I had something I called the ghost hands, and it felt like a warm pair of hands that would grab me from behind the waist, and it was such a great feeling as opposed to so many that weren't. Problems that you see before being diagnosed as far as your typical Parkinson's symptoms or bad sleep, weight loss. I've never really been able to put on any weight since I've been symptomatic. Muscle twitches, sweating, forgetfulness, and some of the cognitive things are really disturbing. You think you're losing your mind and you're not sure, and doctors look at you funny and they're not sure either, and it kind of compounds to the frustration, and you get frustrated and they're frustrated, and sometimes it compounds to a point where you can't even effectively work together to try and get a diagnosis. Fine movement motor skills are very noticeable. When you sit down and your hands are shaking to the point where they're not even tired anymore, they're just still shaking, and if you had any control, you'd stop it, and you'd think the fatigue would stop it alone, and it just doesn't. Frustrations that they experience in trying to get diagnosed. Sometimes doctors don't take good notes, and you don't know if they're having a bad day or if they're really just kind of burnt out on their job. But I saw a neurologist that was recording my primary symptoms starting all on my left side, where all the other neurologists I saw were documenting on the right side. So then I went to see a new neurologist, and they thought maybe I was embellishing and had switched up sides and gotten things confused. But it's very important to advocate for yourself. And one thing I didn't do that I'd highly suggest is to take a journal. If you really think you're symptomatic and you could be losing your mind or just losing good body function, you should be taking notes of your most frequent symptoms, because I'd be asked a lot, well, what frequent symptoms do you have? And there would be so many I wouldn't know where to start. Sometimes the frustration gets to the point where, like I said, you can't effectively help yourself. So I guess advice for people trying to seek a diagnosis, or for professionals who are being sought out by somebody who's seeking a diagnosis, is pay attention. Not all the symptoms are the same. My symptoms kind of came on backwards, as according to most people's symptoms arising. It's kind of, I guess take a journal, listen to your patients, advocate for yourself if you're on the patient side. And if somebody's seeking help, trust me, they're emotionally bent out of shape as it is. So as a professional healthcare provider, listen to them, because it matters. I'm not saying coddle them or empathize with them, be very realistic. But at the same time, if you're not sure and they're not sure, don't downplay it, because I did a lot of downplaying. I swept symptoms under the rug for a very long time. And I see now it's affected my ability to take care of myself now. So time lost is it's movement lost, it's motor skill functions lost. You can hear my voice. My voice turned like this months ago and has never come back. Stay strong, and acceptance and gratitude.